Today I'm here to announce that Alberta is ready to safely and cautiously enter Step 2 of our path forward. I want to thank every Albertan who has responsibly observed public health measures through Step 1 over the past several weeks to protect lives and our healthcare system in the process. I know this has not been easy, especially with cold weather in February limiting our ability to gather outdoors. But the sacrifices that Albertans have made are the reason that we're able to take another step forward today. COVID-19 is still here, and it is still very much a threat to our health and our healthcare system. Still, over the past few months, Alberta has made tremendous progress. Let me highlight just a few examples of how far we've come. Our healthcare system, which we all rely on, continues to see a sharp decline in people admitted to hospital and in intensive care due to the novel coronavirus. From a peak of about 950 patients in hospital, we are down to 257 today with COVID-19, about 200 patients below our threshold that we set for entering this phase 2 in Alberta's path forward. Our long-term care and designated supported living facilities, typically called nursing homes, have seen cases plummet. Thankfully, active cases in our long-term care facilities have now declined by more than 95% from December's peak. And the active cases in designated supported living facilities for seniors have dropped by over 92%. So this is encouraging data, and this data speaks to both the sacrifices that millions of Albertans have made, as well as the huge impact of COVID-19 vaccination since we've delivered the second dose to all the residents of those facilities. When we started Step 1 of the path forward on the 8th of February, there were 432 COVID patients in hospital and 76 in intensive care. Today, we have 257 people in hospital, as I mentioned, 48 of whom are in intensive care units. All of which means that we're not out of the woods, but we can continue taking small steps forward as we go into Step 2. Effective today, targeted health measures will be eased for indoor fitness activities and for libraries. As a cautionary measure, possible changes to current restrictions for retail, hotels, banquets, community halls, and conference centers have been delayed, given that we have seen a small recent increase in the testing positivity rate and the number of active cases. Minister Shandro will provide more details on what specifically we will ease for these sectors in a couple of minutes. Alberta is taking a careful approach, as we said that we would when announcing the path forward back in January. While our hospitalizations are dropping, we have seen cases at the same time level off, so the number of active cases has leveled off recently, and the testing positivity rate has risen a bit. We also have observed a small increase in the daily number of new variant cases, and that is worrisome too. That's why we have to proceed cautiously while still moving forward. I know that many Albertans want us to relax many more health measures today, but we cannot and we must not allow exponential growth to start to take hold, driven by these new, more contagious variants, as we've seen in many countries around the world, because to do so would end up in weeks jeopardizing our healthcare system. So we must take a balanced approach and move carefully and safely, focused on the data, and with the expert advice that we receive from the Chief Medical Officer and the Public Health Team.